are, kindly bring us up to speed with what's happening in as far as this health situation is concerned.
Well, Fred, a very good morning to you. And like you said, yes, we indeed coming live to you from the Nakuru Level 5 hospital. It is also a referral and teaching hospital here in Nakuru County. But understand we are here just to keep an eye and also do a spot check on what is happening and the state of the facility days and weeks after our doctors began their strike. And also to tell you that the country is teetering on the brink of a health catastrophe as doctors across the country laid down their tools, complaining of a raft of issues that they say remain unaddressed since 2017. And of course, they lamented that 2017 it happened that there was another catastrophe, or rather health catastrophe, that led to strike and also leading to having a collective bargaining agreement of 2017, which they say all the agreements that were in that CBA have not been addressed so far. And that is why we just here to get to know how it is all about. But if my camera person would pan for you, this is how the situation is at the Nakuru Level 5 hospital. It is early in the morning. It's around 7:54, but I can see some patients are just here ready to receive their treatment. But understand that this very hospital serves other counties, not only Nakuru County, but serves other counties, neighboring counties. And also we understand that it is a very crucial hospital, and also we see been referred to this hospital, and activities as per now are not as usual, because this place normally, Fred, just to tell you, is always flowing, always overflowing, and the patients always come here. But as you can see, just a number of patients coming here. But just to give you an update, or rather an update of what is happening, is that we have see a nurse right here trying to receive patients, and of course referring them to the relevant places. And as you can see, they're getting, some of them are getting into the emergency. We are at the casualty point, Fred, just to let you know, and some of them are getting right at that door is where probably they go to get the attention of the doctor, and from there they proceed to getting their treatment. But that is how the situation is from the Nakuru Level 5 hospital. I had earlier talked to the medical superintendent of this particular hospital, that is Dr. Waweru, who we hoped that we could have a talk, but unfortunately he is not around. But we will get to talk to him later in the day, because they will be having, they will be having a meeting right in this hospital together with the CEC for Health, that is Dr. Roslyn. But just before I came on air, Fred, just to tell you, is that I had talked to Dr. Roslyn, who is the CEC, Nakuru County CEC for Health, and she told me that they really recognize that the efforts and sacrifices made by the health workers, and so they're working and trying to put it together. And so we hope that Nakuru County will be one of the counties probably will be able to solve this particular crisis. But also understand, I had also talked to the medical superintendent, whom I asked if at all we won't be allowed to other places of this, or rather to other points of this very hospital, what is ongoing. So Dr. Waweru, of course, updated me that at this very point has some few activities. As you can see, we'll also be proceeding to the maternity wards, where we will get to see how it is. But according to the medical superintendent, it is somehow active, but we shall be getting there later. And also we shall get to the X-ray where we shall also get to see what is happening there. But like I have told you, is that I had talked to the CEC, the Nakuru County CEC for Health, that is Dr. Roslyn, and of course I have told you what he said. And like I told you initially, Fred, is that Nakuru County, or rather Nakuru Referral Hospital, is not just a hospital that serves patients from Nakuru County. It serves patients from other neighboring counties, and also it's a hospital that is so much dependent on people. And when we see activities being very few, we wonder if probably we shall ever get these very services from the doctors. And of course, I had also talked to the South Rift Secretary General, that is Stephen Omondi, KMPD South Rift SWIFT Secretary General Stephen Omondi, who said that today they will be having an assembly in Nairobi, doctors' assembly in Nairobi, where they will be gathering there at the Fair grounds in Nairobi, where they will be addressing matters regarding their welfare. And so we hope probably they'll come up with a solution, and maybe they will also have a sit down with the relevant authorities to see whether these very services will be able, or rather these very crucial service providers will be able to return to the hospitals and probably provide services. But just to alert you is that as at right now, Fred, what is currently happening at the Nakuru Level 5 hospital is that we just have a few of activities happening here, but I can see just some few people getting in here, of course with all hopes that they will get the services that they need. Earlier I had seen some, of course, people trying to get in here, and of course passing through these very point. As you can see, the nurse is busy getting their of course testing, or rather getting their measurements and data. From there they shall get to the room just in front of where they are. There is a door, like I told you initially, but we hope and we understand that these are very crucial service providers, that are the doctors and health workers in general, will have a sit down, because Kenyans are lamenting that they are not able to get these crucial services that they have been anticipating, or rather they have been really yearning to get. And normally we understand, and we had talked to other patients saying they do not have the capacity, or rather they do not have enough money to go to private hospitals, and so public hospitals are their hope. And as you can see, Fred, just to tell you right now, I can see some people just trying to get in. So there is just some activities ongoing, but we shall get to hear more from them. I had tried to get hold of some patients to see whether we shall be able to talk to them, but unfortunately some of them are not willing to be on camera. But I am here, Fred. I will keep an eye on this, and definitely from the casualty point I'll be heading to the maternity point, where I'll be getting to know how things are going on there. But also I will also be waiting for the Nakuru County CEC, that is Dr. Roslyn, together with the medical superintendent of this very hospital, to give me an update, or rather to be able to have an interview that I will later, of course, come live on air and tell our viewers what I'll have gathered by that time. So for now, allow me keep an eye on this, and I will definitely come on air and tell, or rather update our viewers to what will be happening. Over to you, Freddie. My name is Chichi Josephine.